Hello, everyone. Thanks for listening to Vita May podcast. I'm happy to recommend using Anchor.fm as my podcast tool. It's a free tool. It automatically publishes your podcast to Spotify. You may manually submit your podcast to Apple Podcasts, Google Play Music, Castbox.fm, and others. It is straightforward to use from your mobile phone application or computer and laptop browser. You can invite friends and record when ready and more. You may also monetize by recording guided ads that you select per episode. Join in on the fun of sharing your experiences and stories and download the free Anchor app or go to anchor.fm to get started. Again, that's anchor.fm. Thank you.
Welcome to Vita May. The topic for today is Menopause for Women. I'm honored to have Elise Salamoni as a speaker and our guest for this episode. Welcome, Elise. I'm very excited to introduce her. I met her in Lean In Foundation, and we had a nice, great conference around the world. She is one of the Lean In women veterans, and I call her Wonder Woman as well. She's also a career transition coach for the Entrepreneur's Force. If you don't mind, can you please introduce yourself and give some background?
Yes. Hi. So I'm Elise Salamoni, and the reason why I am speaking on this topic is because my primary profession is I'm a women's health nurse practitioner. So I've taken care of women starting from the age of 12 to 70, 75. And menopause is actually one of the most common reasons why women come and see me.
She's perfect for this topic, and I'm glad she's able to join us even on a very set and very busy schedule. Why do you feel that this is essential to discuss for women, talking about menopause in general?
I think one of the reasons why it's important for all of us to talk about menopause is one, because it's like anything in women's health, providers, doctors, nurse practitioners, PA don't get a lot of education specifically on women's health. And women are taught not to talk about certain things. We don't talk about our menstrual cycles. We don't talk about infertility issues. We don't talk about menopause. And sometimes how we find out that we're struggling with something is when you talk to another friend and you happen to bring it up and you're like, oh, I have that thing too. And I didn't know that meant this. So I think menopause is something that we all as women will go through. I think it's a very underspoken and undereducated area of women's health. And I just want women to know some of the key things that they need to know about that. There are 3 phases to menopause, and perimenopause usually starts in your mid-30s. And usually some of the symptoms in perimenopause is changes in your menstrual cycle. It can either get longer or heavier or lighter, or you can start having, just some irritability, maybe some mild insomnia. You can maybe having some mild anxiety. And one of the things that's really important, that if you're having these symptoms in your let's say mid-30s, is that you do go in and get checked out and make sure that your provider does some testing. Make sure you check your thyroid, make sure that that's not the issue, and check out some other blood work to see if there's any underlying cause that may not necessarily be perimenopause, but it's something else that's causing these symptoms. And then you get into your late 40s, early 50s, and that's your menopausal phase. And all menopause means it's no bleeding for 1 year. So if you have no bleeding for 1 year, at that 1 year mark, you're considered menopausal. Okay. You may not be bleeding. And here's the thing, you may not be bleeding because you had a partial hysterectomy or a hysterectomy, or you have an IUD like a Mirena, or you have another form of birth control like the Nexplanon, and those can cause you not to bleed, and that's okay. But if you're stopped bleeding naturally because you're going through menopause, the thing that's important about that is, one, to kind of notate when that happens and let your provider know. But also, it's important to know this because if you have any postmenopausal bleeding, meaning that, let's say you are 52, 53, you went through menopause at 51, which is the average age for menopause in around the world, So at 51, you stop bleeding, no more cycles. You're like, woohoo! I don't have to worry about birth control anymore. I don't have to worry about my, monthly bleeding, whatever. But then a year or two later, you all of a sudden spotting or having some bleeding again. This is imperative that you go and see your provider, because that could be a first sign of uterine cancer, to have postmenopausal bleeding. So you need to go and let your provider know, so that they can figure out if it's appropriate for you to get a uterine biopsy. So that can get really technical, but it's actually fairly simple. But it's something to know that if you go through menopause at 51, 48 or whatever, and then all of a sudden you start bleeding a couple years later, it's really important that you go in and get seen.
Okay, that's definitely very important. So are there any preparations you can do? For example, I mean, not everybody seems to have this conversation. It's very much like almost a taboo, a secret. Yes. How do we bring up this conversation with family and friends, maybe, to get this topic more available and aware for us?
I think it's actually for us women, if your mother is still around, I really think it's really important to ask your mom and your sisters, if you have older sisters, hey, have you gone through menopause? What are some of the symptoms you have? Because if you're family, most likely you're going to have similar symptoms. Like I know my middle sister has hot flashes just like I do. My little sister hasn't had any hot flashes, but my mom hasn't had any hot flashes. My mom said I had a beautiful menopause. I didn't even know, it happened. So everyone's different, but if you talk to the other females in your family, you may get an idea of what to expect.
Okay, well, how about if they don't have any that they can speak to? And nowadays more families are split up.
Yeah, so then I would say you can do some research on menopause, or you can talk to your provider. I mean, your provider is always a good person to talk to, but if you find that your provider doesn't have time or isn't really very knowledgeable on menopause, there's actually, let me look real quick, but there's a national menopause organization that they have tons of patient education stuff that you can read up on. And let me hold on one second, and I will. Okay. This is what I meant to look up for you. But yeah, that menopause organization is called North American Menopause Society. And that has a lot of, you can go onto their website and you can download a lot of resources for women we talk to you about some of the things to be concerned about, when you should go in to see your doctor and so forth. So it's called the North American Menopause Society. Okay, I noted that. Thank you so much. You're welcome. And there's a lot of women's health websites out there too that you can look up. So, it's just, talk to your provider, talk to your friends. But if you're having a symptom that you're concerned about, I really recommend you go in and get seen.
Is there a trend that more women are becoming more educated on this as years pass by? Is there more, or is still as before for many years?
Yeah.
Oh, wow.
Yeah. When I was working at my last job, I had quite a mix of population, and it was really interesting how uneducated and ignorant women are about their bodies, and just not menopause, but their menstrual cycle. Like I would have patients that came in and were having perimenopausal bleeding, which means that their periods were getting really heavy and painful, and they didn't know what to do or what they could do. And if I recommended a Mirena, which is one of the treatments for the Mirena, is an intrauterine device that you can put in, and that it can slow down your bleeding or actually stop you from having your menstrual cycle. And they're like, oh, but we need to have our menstrual cycle. And I'm like, wow, you're not trying to get pregnant, are you? And they're like, hell no. Well, if you're not, the only reason we have a period is to get pregnant, is to prime our uterus for pregnancy. So, so there's no reason why, if you're in your perimenopausal phase where your bleeding is getting heavier or longer, that one of the treatments you can ask for is either you can do birth controls or you could do the IUD, which is one of the number one treatments for it. But also, it's important to let your provider know if your cycle is really changing, because if if it went from being a fairly normal cycle, it only lasted 7 days and, would start really heavy, but then get lighter, that's fairly normal. But if all of a sudden your periods are getting a lot heavier and painful, or if you're having bloating, those are potential signs of a uterine fibroid or ovarian cancer. So it's just really important to kind of be mindful and discuss changes in your menstrual cycle that are a bit concerning to your provider.
Okay. How do they know that they're really getting the right support? Because I know even personally myself, I've had to go through many different providers just to make sure I'm getting the right definition, the guidance, the explanation, and not to mention good bedside manners, right? To make sure that we're comfortable with them for, to help us. I feel like it's like car shopping almost. I have to keep hunting at least 5-10 doctors just to get the right one. And that experience stops people from going, I believe, right? That's probably adding to the problem. If they have a bad experience with one, they're not going to go back to actually check themselves.
Yeah.
So
I think this is where I'm going to put a plug in for nurse practitioners. I think nurse practitioners are very well versed, and they usually have a little bit longer appointment. I think before you go to your appointment, to prep with your questions and your concerns, because that's a problem. A lot of times we have 20 minutes or a 15-minute appointment, and the patient comes in and they start telling you these long stories, and you want to listen to them, but you don't have time. So you kind of have to go in there and be very focused and intentional about what you need to discuss. And also, if you can find a women's health nurse practitioner, I mean, this is our specialty. So we can really focus on what is it that's going on and spend a little bit of time explain to you what your body's going through.
Okay, so while we're there, what are some things that you wish they would ask? So if you had to prepare somebody, what are good questions they should ask when going to get checked?
So some of the questions that I always ask is, when did you start your period? How old were you? Because a lot of times, depending on when you started your period, that'll kind of give you an indication of people that started the period younger will generally go through menopause a little bit younger. People that go through, started their period a little bit later, like, 15 or 16, they may go through menopause, may not occur till a little bit later in life. Also, a big thing that is really important is if you're in your late 30s, mid 40s, do you know that that's the highest percentage of undesired pregnancies? Because women think, oh, I'm too old to get pregnant. No, if you're still menstruating, you can still get pregnant. So you need to be on some form of birth control if you do not want to get pregnant. So that's something that really occurs almost daily in the practice. The other thing is too, if you're having changes in your cycle that are concerning, when you're bleeding and you're soaking through, that's not necessarily normal. So talk to your provider about making sure that you're getting tested for fibroids, or make sure that you don't have any other bleeding issues going on. I'm trying to think. And I think birth control in mid-age is something that we don't really talk about. And that's why we have a lot of women sometimes that come in at 42 and like, I haven't had a period for a couple months. I'm not feeling well. And you do a pregnancy test and like, oh, well, you're pregnant. And they're like, what? So
wow.
And that happens a lot. I wish I could say that that's an uncommon occurrence, but it's not. And even like I would have patients that were in their late 40s and were still menstruating and still sexually active with their partners. And I would say like, what are you doing for birth control? I'm like, nothing, I'm too old to get pregnant. I'm like, you're still menstruating, right? And they're like, yeah. And I'm like, okay, then you can still get pregnant. So I've had patients, 48, 49, 50, with an unexpected pregnancy. So that's just something else to think about. Yeah.
I can't believe that they thought they wouldn't if they're still menstruating. I thought that was
well, you know
what?
This is a lapse in medicine where women come in and people don't ask them those questions and they just don't know to ask. So I think perimenopausal pregnancies are actually, they can be fairly common because no one's having the conversation with, the patient saying, as long as you're menstruating, you can get pregnant. So you need to have some kind of protection, whether it's condoms, birth control, IUD, whatever.
Interesting. Well, I'm glad we're talking about that today. I did not expect people to think that, but hey, this is the reason why we're having this podcast. We want to make sure that this conversation keeps happening. what do we do if women are going through menopause as somebody that's just supporting them? What can we do to help? I know I've heard of mood swings as another problem that they might have, or memory loss, even memory lapse, right? What can we do to support somebody that's going through this?
Well, I'm gonna go back to the basics. Make sure you're getting enough sleep. Make sure that you're eating healthy. Make sure that you're exercising. Those are always the first places that I start. And then there's some supplements like ginkgo that help with your memory. Also, making sure that at night you get off your phone a couple hours before before you go to bed, so that you actually get some restful sleep. If you're having hot flashes at night and you drink alcohol at night, I usually tell patients stop drinking alcohol at least 2 to 4 hours before you go to bed, because drinking, wine before you go to bed, a couple hours before you go to bed, can actually make your hot flashes worse. Bone is really important during your perimenopause and postmenopausal period. So taking vitamin D and calcium and doing weight-bearing exercises are important to keep your bones healthy. I'm trying to think what else. Those are the big things. And if you're having hot flashes, some of the triggers for hot flashes are being overweight, low vitamin D, foods can be triggers like chocolate, hot spicy stuff, alcohol, caffeine. If you drink a lot of caffeine and you're having a lot of hot flashes, that may be something that you want to come back on a little bit. And some of the basics things, if you have a tendency to have a lot of hot flashes at night during bedtime, keep your room cool. Just go to bed with as little bit of clothes as possible, or even naked. Have a fan. Make sure you're drinking lots of water. And a lot of this stuff seems really basic, but people just don't do it. And they suffer, or they come in and they immediately want a pill or medication, when a lot of this stuff you can take care of by just doing basic self-care.
Wow. Well, how about if they're at work? What are some things I know?
Yes.
That's a struggle
I will
too.
tell you from a personal experience that I just wore layers to work. I would always have like a lighter, like if I got cold, I had a light sweater or a lab coat I could put on, or I could take it off and just have a short sleeve shirt. Or I used to keep a fan by my desk, and I'm always drinking water, and ice water helps. But sometimes hot flashes they just suck.
It just happen.
I mean, we can give you medication for hot flashes, and you can take black cohosh, 40 milligrams a day, which you could get over the counter, which sometimes helps. But if you've had any history of breast cancer, you kind of have to be careful with that. So there's a lot that kind of goes into it. There's not one prescription for all, but black cohosh over the counter helps with hot flashes, and people can research that if they want. But like I said, your diet, sleep, drinking lots of water, being well hydrated, really make a huge difference.
Wow. Yeah, it's the basics, like you said. It's not even just for this, but anything really.
Not for anything, absolutely.
Yeah. Okay, so that's a lot to think about, and definitely useful tips. Anything that you wish I should have asked you during the interview that we could share?
Let's describe hot flashes really quick. So,
okay.
Hot flashes feel like you are burning. They can feel like a mild flush, but sometimes women will have such hot flashes that it feels like you are burning from the inside out, and that's a hot flash. And I remember when I was going through nurse practitioner school, I was running a little late for a clinical, and I was running, so I thought I was hot from that, but then it just took me forever to cool off, and the nurse looked at me and she's like, "You're having a hot flash." And I was like 40-something years old in graduate school for my nurse practitioner program. I'm like, how did I not recognize that in myself, So, and it's really hard because our partners a lot of times are like, "Are you crazy? Like, why do you keep taking your blanket off or putting something on and taking it off?" But it's just, hot flashes are a real thing, and they can be really bothersome, and they can be embarrassing because some women get really sweaty. So I really encourage women that if you're really struggling with hot flashes, to talk to your provider. Make sure you get some lab work done. Make sure there's nothing else going on, like your thyroid being not functioning well. but make sure that you have cold water. Really does help. If you're drinking hot, always have some water with you, because that does help at least make you feel a little bit cooler, and keep a fan near you. But yeah, hot flashes are real. They're real.
Oh, I get to look forward to that. It looks like.
Oh, not everybody gets them. Not everybody gets them.
True.
Some people go through menopause and never have a hot flash. But for some of us that get them, it's really a painful process.
Yeah. So if they don't get it, they might get the other things, right? Just like.
Yeah, they may get other things. Or they may get all of it. They may get the anxiety and mild irritability, or the insomnia. Insomnia is a really big problem in menopause and perimenopause for many women. But like my mom, she's 70 and she never went through a hot flash, and for the most part, she had a fairly easy menopause period. So it just really depends. The other thing I want to mention too, that if you do decide to take hormones and your provider prescribes you hormone, make sure that you talk about the risk factors. Like if you decide to take estrogen and you still have your uterus intact, you need to make sure that you are also prescribed progesterone. So that's another whole deeper conversation. And hormones really can be very helpful. Don't be afraid to ask for them, but make sure that your provider spends some time really educating you on the risk factors and the pros and cons of it. Because when you have a lower estrogen, it also increases you have vaginal dryness, which can be very painful for intercourse. And so there's a lot that's going on in this period of our lives and our bodies, and we need to just educate ourselves and ask questions and ask our friends and family, and not be ashamed of it, because this is a period that we all have to go through.
Mm-hmm. Agreed. Are there any misconceptions or myths that you'd like to share that you commonly hear that you've had to educate them on?
The only one I told you was that people thinking that they're in their 40s, that they can't get pregnant anymore. They're too old. I literally have had patients like, I'm too old to get pregnant, and I'm like, it doesn't work that way. So that's probably the biggest myth that I want to talk about. If you're in your mid 40s or even late 30s or whatever, and you think you're too old to get pregnant, if you're still menstruating, you can still get pregnant.
Wow. Yeah, well, it's definitely a wake-up call, I want to say, for sure, because, I mean, you're right. I mean, it could start as early as 30s, late 30s, up to 80s. I didn't think it was going to be that long.
Well, yeah, I mean, I've had patients, and I've been in clinicals where I had particularly an 80-year-old patient, and she says, I'm still having hot flashes. I've been having them for 20 years. And I was like, oh my God, that's terrible. That poor thing. So you can have, the bleeding will stop eventually, and generally by 56, most women are done with their bleeding portion of it, but the hormonal part can last, the changes and the fluctuations can last a little bit longer.
Okay. Yeah, and that's definitely an uncomfortable feeling. And I think we talked about it earlier before we recorded, was that sometimes they misdiagnose it, right? Prescribing antidepressants when this should be something else. So they really need to do some checks to make sure it's not that, and it's this possibly causing the problems that they have. So I definitely want to make sure we include that, because I know my own mother, she's going through depression, and taking those medicines are very risky. I mean, it has very strong side effects. It's not very easy to deal with that, especially if you're going through it's a very long-term medication.
Yeah, well, the problem is if you have depressive symptoms and it's being caused by a hormonal, not because you have organic depression, then the antidepressants aren't really going to help you as much, because you're not taking care of the root problem, which is that your hormones are severely fluctuating and your estrogen levels may be really low. So it may just be a matter of you having some estrogen and progesterone replacement, which is really what you need, and not necessarily antidepressant. And I don't want to negate the role of antidepressants when it's needed, because there's a lot of people that need them and they do much better once they're on them. And same thing with anti-anxiety medication. But there's also, I'm always going to go to the root cause of taking care of your body, the instrument that God gave you, and doing those things of healthy eating, exercising, getting outside in nature. Those things really do make a huge, huge difference.
Awesome. Understandable. The support group too. I mean, having the self-care plus having the support group, to seek help and make sure that they continue to have positive energy from people definitely helps tremendously.
Yes.
We're not suffering alone. We can't be doing this by ourselves. So it's definitely important.
No. And the thing is that all of us women are going to go through menopause, so it's something that, if you have questions about, you need to just ask somebody, and talk to your provider. And, there's plenty of research, and, things that are helpful on the internet that, you can go to those organizations that do women's health and menopause to get help. And also, locally there's menopause providers that actually specialize in menopause that you can go to, and they can talk to you about the different hormonal supplements and options that you can use.
Well, I appreciate you answering all the questions that I have. It's definitely good to hear, at least especially from the provider's perspective, since I know you help support many of them. So it's very good and enlightening to hear that straight from you. So appreciate you joining and take the time to make some space for me. So I appreciate it.
Oh, absolutely, Maybelline. No problem. It was fun talking to you. I hope this helps.
Oh, it does. Thank you so much.
You're welcome. You take care.